Among the most frequent questions I receive, both from physicians and patients, is what has the next generation of therapies that are sort of finally appeared on the scene, how does that fit into the paradigm of how we've managed advanced urothelial or bladder cancer? I think it's really important to recognize that as a senior oncologist, I've been around a long time. When I was a fellow in oncology, cisplatin, its use in urothelial cancer was just starting. And at the time, it was a revolution because there were really no therapies that were useful for this disease. And then all of a sudden, platinum-based chemotherapy, MVAC, other regimens came along, and all of a sudden, subsets of patients were responding to therapy, living longer, or at least appearing so. We were starting to see patients actually develop brain metastases. Nobody with bladder cancer or advanced disease ever developed it because they never lived long enough. So there was a fair amount of enthusiasm associated with the development of these agents. The challenge, of course, is 25 years went by without any changes. So we got really good at using the therapies that we had, but we made no progress. When we start seeing patients now responding to checkpoint inhibitors, and some of the patients who have really dramatic responses that are prolonged, this is really a major shift in the management of the disease. That's the perspective I bring to what's going on today in contrast to what we've been doing for 20 or 30 years. One of the questions that I'm asked, not infrequently by patients, of course, and their families, is survival time. Historically, for a patient who could get cisplatin-based chemotherapy, we talk about median survivals in the 14 or 15-month range. With next-generation therapies, the checkpoint inhibitors, we don't really fully yet have survival data. There's only one presented phase 3 trial. What's pretty clear, however, from the data that is actually in the public domain is that in some of the early trials, the phase 2 trials that led to the approval of drugs like atezolizumab, nivolumab, there are patients who do respond, who are in sustained responses now approaching 2 years. That's unprecedented. Most patients don't respond to these agents, so it's a little bit hard to sort of talk about survival in the big population. But in those patients who respond, we believe that there's a tail on the survival curve, meaning some of these patients may do well for very prolonged periods of time. Too early yet to fully appreciate that, but unequivocally different than what we've seen before.